Question 1. Quality control measures reveal that a batch of surgical instruments processed through the autoclave failed to meet sterility indicators. Which of the following actions represents the most appropriate and thorough initial response to address this critical finding? Option A. Conduct a comprehensive review of the sterilization cycle parameters, instrument preparation, packaging integrity, and the autoclave's operational status. Option B. Focus solely on inspecting the instruments for any visible signs of contamination, as this is the most likely cause of failure. Option C. Immediately re-sterilize the entire batch of instruments to ensure they are safe for use. Option D. Assume the sterility indicators are faulty and proceed with using the instruments after a visual inspection. Correct answer is C. Immediately re-sterilize the entire batch of instruments to ensure they are safe for use. Explanation. Scenario analysis. This scenario presents a professional challenge because a lapse in sterilization quality control directly impacts patient safety and the integrity of veterinary surgical procedures. VTS in clinical practice is expected to have a comprehensive understanding of sterilization principles and their application to prevent surgical site infections and ensure instrument efficacy. The challenge lies in identifying the root cause of the failure and implementing corrective actions that are both effective and compliant with established veterinary practice standards. This requires a systematic approach to problem solving, moving beyond superficial fixes to address the underlying issues. Correct approach analysis. The correct approach involves a multifaceted investigation that begins with verifying the sterilization cycle parameters. This includes checking the autoclave's printout or digital record for temperature, pressure, and time, ensuring they met the manufacturer's specifications for the specific load and type of instruments being sterilized. Following this, a thorough inspection of the instruments themselves is crucial to identify any gross contamination, debris, or damage that might have compromised sterilization. The packaging integrity must also be assessed, looking for tears, punctures, or improper sealing that could allow microbial ingress. Finally, a review of the entire sterilization workflow, from cleaning and rinsing to loading and unloading the autoclave, is necessary to pinpoint any deviations from standard operating procedures. This comprehensive, systematic approach aligns with best practices in veterinary clinical practice, emphasizing patient safety and adherence to established protocols for infection control, which are implicitly or explicitly guided by veterinary practice acts and professional guidelines that mandate maintaining a sterile environment for surgical procedures. Incorrect approaches analysis. One incorrect approach is to immediately re-sterilize the entire batch of instruments without investigating the cause of the initial failure. This is inefficient and masks the underlying problem, which could be a malfunctioning autoclave, improper loading, or inadequate cleaning. Re-sterilization without understanding the root cause does not guarantee future success and may lead to repeated failures, increasing operational costs and delaying patient care. Ethically, this approach fails to uphold the duty of care to patients by not ensuring the highest standards of sterility are consistently met. Another incorrect approach is to assume the sterilization cycle was adequate and attribute the quality control finding to a faulty testing method or a single contaminated instrument. This dismisses the quality control measure, which is designed to detect systemic issues. Ignoring a quality control alert is a failure to adhere to established protocols for ensuring the efficacy of sterilization, which are fundamental to preventing iatrogenic infections. This approach demonstrates a lack of diligence and a disregard for patient safety, potentially violating professional standards of care. A third incorrect approach is to focus solely on the instruments and overlook the sterilization equipment itself. If the autoclave is not functioning correctly, re-sterilizing instruments will not resolve the issue. This narrow focus fails to address potential equipment malfunctions, calibration issues, or maintenance needs that are critical for effective sterilization. It represents a failure to conduct a thorough risk assessment and implement appropriate corrective actions, potentially leading to a recurring problem that compromises patient safety and the clinic's reputation. Professional reasoning. Professionals facing such a situation should employ a systematic problem-solving framework. First, acknowledge the quality control finding as a critical alert requiring immediate attention. Second, initiate a thorough investigation, starting with verifying the sterilization parameters and then systematically examining the instruments, packaging, and the entire workflow. Third, consult the manufacturer's guidelines for for the sterilization equipment and instrument reprocessing. Fourth, implement corrective actions based on the identified root cause, which may include equipment repair or recalibration, retraining staff, or revising standard operating procedures. Finally, revalidate the sterilization process to ensure the corrective actions have been effective. This methodical approach ensures that patient safety is prioritized, regulatory compliance is maintained, and the highest standards of veterinary clinical practice are upheld. Question 2. Implementation of a new point-of-care coagulation analyzer in a busy small animal hospital has led to the generation of several results for a patient presenting with lethargy and suspected gastrointestinal bleeding. The results show a significantly prolonged activated clotting time (ACT) and a markedly decreased platelet count. What is the most appropriate immediate action for the Certified Veterinary Technician Specialist, VTS, clinical practice? Option A. Immediately notify the attending veterinarian of the critically abnormal ACT and platelet count, recommending a review of the patient's clinical status and potential for coagulopathy. Option B. Rerun the ACT and platelet count on the same analyzer to confirm the initial findings before reporting them. Option C. Document the results in the patient's chart and wait for the veterinarian to review them during their next scheduled rounds. Option D. Proceed with administering prescribed medications for gastrointestinal upset, assuming the coagulation results are secondary to the primary condition. Correct answer is A. Immediately notify the attending veterinarian of the critically abnormal ACT and platelet count, recommending a review of the patient's clinical status and potential for coagulopathy. Explanation. The scenario presents a common challenge in clinical practice, interpreting and acting upon laboratory results that may indicate a serious underlying condition. The professional challenge lies in the VTS's responsibility to recognize the potential severity of abnormal coagulation test results, understand their implications for patient safety, and communicate these findings effectively to the veterinarian. This requires not just technical knowledge of coagulation assays, but also an understanding of their clinical significance and the regulatory framework governing veterinary practice. The correct approach represents best professional practice because it prioritizes patient welfare and adheres to the principles of responsible veterinary care. By immediately alerting the veterinarian to the critically abnormal results, the VTS ensures prompt medical intervention, which is crucial in managing potential bleeding disorders. This aligns with the ethical obligation to act in the best interest of the animal patient and the regulatory expectation that veterinary professionals maintain a high standard of care. The VTS's role in recognizing and escalating critical findings is a cornerstone of effective team-based veterinary medicine. An incorrect approach that involves delaying notification or assuming the results are erroneous without further investigation fails to meet the standard of care. Such delays could lead to adverse patient outcomes, including uncontrolled hemorrhage, which would be a direct violation of the VTS's duty of care. Furthermore, failing to communicate critical findings promptly to the supervising veterinarian could be considered a breach of professional responsibility and potentially a violation of practice acts that mandate reporting of significant diagnostic information. Another incorrect approach, such as performing additional, non-indicated tests without veterinary direction, could lead to unnecessary costs for the client and delay essential diagnostic and therapeutic actions, demonstrating a lack of professional judgment and potentially exceeding the scope of practice without explicit veterinary authorization. The professional reasoning process in such situations should involve a systematic evaluation. 1. Recognize critical values. Identify results that fall outside established reference ranges and are clinically significant. 2. Assess clinical context. Consider the patient's signalment, history, and presenting signs. 3. Communicate promptly. Immediately inform the veterinarian of critical findings. 4. Follow veterinary direction. Implement diagnostic and therapeutic plans as directed. 5. Document thoroughly. Maintain accurate records of all findings, communications, and actions taken. This structured approach ensures that patient safety is paramount and that all actions are aligned with professional standards and regulatory requirements. Question 3. System analysis indicates a 7-year-old intact female Labrador Retriever presents with acute onset of lethargy, anorexia, and vulvar discharge. Physical examination reveals a palpable, enlarged uterus and mild abdominal discomfort. A complete blood count shows a marked leukocytosis with a left shift, and a serum chemistry panel is within normal limits. Based on these findings, what is the most appropriate immediate action for the Certified Veterinary Technician Specialist, VTS, clinical practice? Option A. Immediately notify the supervising veterinarian, providing a concise summary of the patient's history, physical exam findings, and diagnostic results, along with a suspected diagnosis of pyometra and a recommendation for surgical intervention. Option B. Present the raw laboratory data, CBC and chemistry results, to the veterinarian without offering any interpretation or clinical assessment. Option C. Continue with routine patient care and diagnostic procedures for other hospitalized animals before informing the veterinarian about this specific case. Option D. Administer broad-spectrum antibiotics and intravenous fluids as per standard protocol for suspected infections without consulting the veterinarian. The correct answer is A. Immediately notify the supervising veterinarian, providing a concise summary of the patient's history, physical exam findings, and diagnostic results, along with a suspected diagnosis of pyometra and a recommendation for surgical intervention. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misinterpretation of diagnostic findings and the critical need for accurate, timely intervention in a reproductive emergency. The technician's role in recognizing subtle clinical signs, understanding the underlying pathophysiology, and communicating effectively with the veterinarian is paramount. Failure to act decisively or to accurately relay information can lead to significant patient morbidity or mortality and potential legal or ethical repercussions for the veterinary practice. The complexity arises from the need to integrate multiple pieces of information: patient history, physical exam findings, and diagnostic results to form a coherent clinical picture. Correct approach analysis. The correct approach, which involves immediate notification of the veterinarian with a concise summary of findings and a proposed course of action based on the suspected diagnosis, represents best professional practice. This aligns with the core principles of veterinary technician practice, emphasizing the technician's responsibility to assist in patient care, recognize emergencies, and communicate effectively. Regulatory frameworks for veterinary technicians, such as those governing the practice of veterinary medicine and the scope of veterinary technician duties, implicitly or explicitly require technicians to act as patient advocates and to escalate critical findings to the supervising veterinarian. Ethically, this approach prioritizes patient welfare and demonstrates professional competence and diligence. Incorrect approaches analysis. One incorrect approach involves delaying notification to the veterinarian until after completing all routine tasks. This fails to recognize the emergent nature of the suspected condition. Regulatory guidelines for veterinary practice emphasize prompt assessment and treatment of emergencies. Ethically, this delay constitutes a failure to act in the best interest of the patient, potentially exacerbating the condition and increasing risk. Another incorrect approach is to provide the veterinarian with raw, uninterpreted diagnostic data without offering a clinical assessment or proposed action. Providing data is part of the technician's role. Failing to synthesize this information into a clinically relevant context hinders the veterinarian's ability to make rapid, informed decisions. This can be seen as a failure to exercise professional judgment and to fully utilize the technician's diagnostic support capabilities, which are expected under Veterinary Practice Acts. A third incorrect approach is to make a definitive diagnosis and prescribe treatment without direct veterinary supervision. This directly violates the scope of practice for veterinary technicians, which prohibits independent diagnosis and treatment. Such an action would be a clear regulatory violation and an ethical breach, undermining the veterinarian-client-patient relationship and potentially harming the animal. Professional reasoning. Professionals should approach such situations by first prioritizing patient assessment and recognizing potential emergencies. This involves a rapid evaluation of the patient's condition, integrating historical information, physical examination findings, and any available diagnostic results. The next crucial step is effective communication. This means synthesizing the gathered information into a clear, concise report for the veterinarian, including a preliminary assessment and, where appropriate, a suggested course of action. This process ensures that the veterinarian receives critical information promptly and in a clinically relevant format, enabling efficient and effective patient management. Professionals must constantly be aware of their scope of practice and the regulatory framework governing their actions, always prioritizing patient welfare and acting ethically. Question 4. The risk matrix shows a moderate likelihood of laboratory result discrepancies impacting patient care. A veterinary technician specialist in clinical practice is reviewing the results of a serum biochemistry panel for a feline patient presenting with lethargy and anorexia. The panel reveals a significantly elevated blood urea nitrogen, BUN, and creatinine, consistent with renal insufficiency. However, the patient's urine-specific gravity is within the normal range, and the physical examination findings do not strongly suggest severe dehydration or overt signs of chronic kidney disease. What is the most appropriate next step for the VTS to ensure accurate interpretation and patient management? Option A. Correlate the biochemical findings with the patient's signalment, history, physical examination, and urine-specific gravity to identify potential causes for the discrepancy and discuss with the veterinarian. Option B. Assume the urine-specific gravity is erroneous and focus solely on the BUN and creatinine values for diagnosis. Option C. Immediately recommend a renal biopsy to confirm the diagnosis of kidney disease. Option D. Report the elevated BUN and creatinine as definitive evidence of renal failure and proceed with treatment protocols for chronic kidney disease. Correct answer is A. Correlate the biochemical findings with the patient's signalment, history, physical examination, and urine-specific gravity to identify potential causes for the discrepancy and discuss with the veterinarian. Explanation. This scenario presents a professional challenge due to the critical nature of diagnostic laboratory results in veterinary medicine. Misinterpretation or improper handling of chemical analysis data can lead to misdiagnosis, inappropriate treatment, and potentially adverse patient outcomes. The Certified Veterinary Technician Specialist, VTS, in clinical practice is expected to possess a high level of expertise in laboratory procedures, including the understanding of analytical principles and the ability to critically evaluate results within a clinical context. Adherence to established protocols and regulatory guidelines is paramount to ensure accuracy, reliability, and patient safety. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based evaluation of the chemical analysis results. This involves not only verifying the technical accuracy of the test itself, but also considering the broader clinical picture. By correlating the laboratory findings with the patient's signalment, history, physical examination findings, and other diagnostic data, the VTS can identify potential discrepancies or confirm the validity of the results. This comprehensive approach aligns with the ethical responsibility to provide competent care and the regulatory expectation of maintaining high standards in diagnostic services. It also reflects the VTS's role as a crucial member of the veterinary healthcare team, contributing informed insights to patient management. An incorrect approach that solely relies on the numerical output without considering the clinical context is professionally unacceptable. This failure to integrate laboratory data with patient information can lead to diagnostic errors. Ethically, it violates the principle of beneficence, as it may result in suboptimal patient care. From a regulatory standpoint, it demonstrates a lack of due diligence and adherence to the expected standards of practice for a specialized veterinary technician. Another incorrect approach that involves immediately initiating treatment based solely on a single abnormal value without further investigation or confirmation is also professionally unacceptable. This can lead to unnecessary or inappropriate treatments, potentially causing harm to the patient and incurring additional costs. It bypasses the critical step of diagnostic validation and can be considered a breach of professional responsibility. A further incorrect approach that involves discarding or ignoring results that do not align with a preconceived diagnosis is a significant ethical and regulatory failure. This demonstrates bias and a lack of scientific integrity, compromising the objectivity required in diagnostic interpretation. It directly contravenes the principles of accurate record-keeping and evidence-based medicine. The professional decision-making process for similar situations should involve a structured approach. 1. Review the laboratory report thoroughly, noting all parameters and their values. 2. Compare the results against established reference ranges for the species and age of the patient. 3. Critically evaluate the clinical relevance of any abnormal findings in the context of the patient's signalment, history, and physical examination. 4. Consider potential sources of error in sample collection, handling, or analysis, and if necessary, recommend repeat testing or confirmatory assays. 5. Consult with the veterinarian to discuss the findings and their implications for patient management. 6. Document all findings, interpretations, and recommendations clearly and accurately. Question 5. Cost-benefit analysis shows that a client is hesitant about the expense of extensive diagnostic procedures for their cat presenting with acute dyspnea and crackles on auscultation. The veterinarian has requested the VTS in clinical practice to propose a diagnostic strategy. Which approach best balances diagnostic accuracy, client financial considerations, and optimal patient care within the VTS scope of practice? Option A. Immediately recommend a full panel of blood work including complete blood count, chemistry panel, and infectious disease titers, along with an echocardiogram to rule out cardiac causes of respiratory distress, before any imaging of the lungs. Option B. Advise the client that only the veterinarian can make diagnostic decisions and that the VTS cannot offer any recommendations regarding diagnostic pathways due to cost concerns. Option C. Recommend a stepwise diagnostic plan starting with thoracic radiographs and blood gas analysis, followed by bronchoalveolar lavage if initial findings are inconclusive or suggest infection, and consider advanced imaging like CT scan only if these initial steps fail to yield a diagnosis or guide therapy. Option D. Suggests starting empirical treatment with broad-spectrum antibiotics and diuretics based on the presenting signs, and defer all further diagnostic considerations until the patient shows a response or deteriorates. The correct answer is C. Recommend a stepwise diagnostic plan starting with thoracic radiographs and blood gas analysis, followed by bronchoalveolar lavage if initial findings are inconclusive or suggest infection, and consider advanced imaging like CT scan only if these initial steps fail to yield a diagnosis or guide therapy. Explanation. This scenario presents a professional challenge due to the need to balance immediate patient welfare with resource limitations and the potential for long-term patient outcomes. The Certified Veterinary Technician Specialist, VTS, in clinical practice must exercise sound judgment in recommending diagnostic and therapeutic interventions, considering both efficacy and economic feasibility for the client. The regulatory framework for veterinary practice, as governed by the relevant U.S. State Veterinary Practice Acts and the AVMA Principles of Veterinary Medical Ethics, mandates that technicians act within their scope of practice, uphold the highest standards of patient care, and communicate effectively with veterinarians and clients. The correct approach represents best professional practice because it prioritizes a comprehensive diagnostic workup to accurately identify the underlying cause of the respiratory distress. This aligns with the ethical obligation to provide competent care and avoid unnecessary or potentially harmful treatments. By recommending a stepwise diagnostic approach, starting with less invasive and more cost-effective methods before progressing to more advanced diagnostics, the VTS demonstrates responsible resource management and client advocacy. This approach ensures that interventions are guided by evidence and tailored to the patient's specific needs, minimizing the risk of empirical treatment that could be ineffective or financially burdensome without a clear diagnosis. Adherence to the VTS scope of practice, which includes assisting in diagnostics and treatment planning under veterinary supervision, is paramount. An incorrect approach that solely focuses on symptomatic treatment without a definitive diagnosis represents a regulatory and ethical failure. This could lead to masking the underlying disease, delaying appropriate treatment, and potentially worsening the patient's condition. It also fails to meet the ethical standard of providing informed consent to the client, as the full extent of the diagnostic possibilities and their implications may not be explored. Furthermore, recommending expensive, advanced diagnostics without first exploring less costly, equally effective initial steps could be seen as a failure in client advocacy and responsible resource management, potentially violating principles of prudent veterinary practice. Another incorrect approach, such as deferring all diagnostic decisions to the veterinarian without offering informed recommendations based on the VTS's specialized knowledge, could be considered a failure to fully utilize their expertise and contribute to optimal patient care, potentially falling short of the expected standard for a VTS. The professional reasoning process in such situations involves a systematic evaluation of the patient's condition, the available diagnostic and therapeutic options, their associated risks and benefits, and the client's financial constraints. The VTS should collaborate closely with the attending veterinarian, leveraging their specialized knowledge of respiratory diseases to propose a logical, tiered diagnostic plan. Clear and empathetic communication with the client is essential to explain the rationale behind the recommendations, discuss potential outcomes, and ensure informed decision-making. This process upholds the veterinarian client-patient relationship and ensures that care is delivered in a manner that is both medically sound and ethically responsible. Question 6. Investigation of anesthetic and analgesic strategies for a 7-year-old canine patient diagnosed with congestive heart failure, CHF, undergoing an elective dental prophylaxis. The patient is currently stable on medication for CHF, but exhibits mild dyspnea at rest. The veterinarian has requested the veterinary technician specialist, VTS, to prepare an anesthetic and pain management plan that minimizes cardiovascular and respiratory depression. Option A. Administer a high dose of a cardiovascularly depressant injectable anesthetic agent to ensure rapid induction and maintenance, and defer all pain management until after the procedure is completed. Option B. Proceed with a standard injectable anesthetic protocol without preemptive analgesia, assuming the dental procedure is minor and the patient's CHF will not be significantly impacted by the anesthetic. Option C. Implement a multimodal pain management plan including preemptive local anesthetic blocks, judicious use of a cardiovascularly stable opioid, and a balanced anesthetic technique with low-dose inhalant anesthesia, while closely monitoring cardiovascular and respiratory parameters. Option D. Administer a pre-anesthetic sedative with significant respiratory depressant effects, followed by a balanced anesthetic protocol using high concentrations of isoflurane, and rely solely on post-operative oral analgesics. Correct answer is D. Administer a pre-anesthetic sedative with significant respiratory depressant effects, followed by a balanced anesthetic protocol using high concentrations of isoflurane, and rely solely on post-operative oral analgesics. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in veterinary anesthesia, managing a patient with a pre-existing condition that significantly impacts anesthetic risk. The presence of congestive heart failure, CHF, in a canine patient scheduled for elective dental prophylaxis requires meticulous pre-anesthetic assessment, careful drug selection, and vigilant intra-anesthetic monitoring. The technician's role is to anticipate potential complications and implement strategies to mitigate them, ensuring patient safety within the established veterinary practice standards and regulatory guidelines. The challenge lies in balancing the need for adequate anesthesia and analgesia with the patient's compromised cardiovascular status. Correct approach analysis. The correct approach prioritizes patient safety by employing a multimodal pain management strategy that minimizes cardiovascular depressant effects. This involves using a combination of analgesic modalities, such as local anesthetics for nerve blocks, judicious use of opioids with known cardiovascular stability, and potentially a balanced anesthetic technique that includes inhalant anesthetics at the lowest effective concentration. This approach aligns with best practices in veterinary anesthesia and pain management, emphasizing a proactive and individualized plan. It adheres to the ethical obligation to provide the highest standard of care and the regulatory expectation that veterinary professionals will act in the best interest of the animal patient, utilizing current knowledge and techniques to minimize pain and suffering. Incorrect approaches analysis. One incorrect approach involves relying solely on high doses of injectable anesthetics without considering their cardiovascular impact. This is problematic because many injectable anesthetics can cause significant hypotension and bradycardia, which are poorly tolerated by a patient with CHF. This failure to tailor the anesthetic plan to the patient's specific condition represents a deviation from best practices and could be considered a breach of the duty of care. Another incorrect approach is to administer a sedative that has significant respiratory depressant effects without adequate respiratory support. Patients with CHF often have compromised respiratory function, and adding a drug that further depresses respiration can lead to hypoxemia and hypercapnia, exacerbating their condition. This demonstrates a lack of foresight and an inadequate understanding of the patient's underlying pathophysiology, potentially violating ethical principles of patient welfare. A third incorrect approach is to proceed with the procedure without adequate pain management, assuming that the dental procedure is minor. This is a critical ethical and regulatory failure. The VTS is expected to advocate for the patient and ensure that pain is managed effectively, regardless of the perceived invasiveness of the procedure. Failure to provide adequate analgesia constitutes animal neglect and violates the core tenets of veterinary medicine. Professional reasoning. When faced with a patient with pre-existing conditions undergoing anesthesia, the professional decision-making process should involve a thorough pre-anesthetic evaluation, including a review of the patient's history and physical examination findings. This should be followed by the development of a tailored anesthetic plan that considers the patient's specific risks and contraindications. Collaboration with the veterinarian is crucial to ensure all parties are in agreement on the plan. During anesthesia, continuous and vigilant monitoring of vital parameters is essential, with the ability to adapt the plan as needed based on the patient's response. The VTS must be prepared to identify and respond to potential complications promptly and effectively, always prioritizing patient safety and welfare. Question 7. What factors determine the extent and invasiveness of a physical examination performed on a patient with a history of respiratory distress and recent surgery? Option A. The availability of advanced diagnostic imaging equipment in the practice. Option B. The technician's personal experience with similar cases without formal risk assessment. Option C. The patient's current physiological stability, the potential diagnostic yield of specific examination components, and the associated risks of exacerbating the patient's condition. Option D. The veterinarian's preference for a complete diagnostic workup regardless of patient status. Correct answer is C. The patient's current physiological stability, the potential diagnostic yield of specific examination components, and the associated risks of exacerbating the patient's condition. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the veterinary technician specialist to balance the immediate need for diagnostic information with the potential risks to a compromised patient. The patient's history of respiratory distress and recent surgery introduces significant anesthetic and physiological risks. A thorough risk assessment is paramount to ensure patient safety and to avoid exacerbating the patient's condition. The VTS must consider not only the diagnostic yield, but also the potential for iatrogenic harm, requiring a nuanced approach that prioritizes the patient's well-being above all else. Correct approach analysis. The correct approach involves a comprehensive risk assessment that integrates the patient's current clinical status, the potential benefits of the physical examination, and the associated risks. This aligns with the ethical principles of veterinary medicine, emphasizing beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Regulatory frameworks for veterinary practice, including those governing veterinary technicians, mandate that practitioners act within their scope of practice and prioritize patient safety. A VTS, with their advanced knowledge and skills, is expected to perform this critical evaluation, considering factors such as the patient's stability, the invasiveness of the examination, and the availability of less risky alternatives. This approach ensures that diagnostic efforts are both effective and ethically sound, adhering to the highest standards of care expected of a specialist. Incorrect approach is analysis. Proceeding with a full, unmitigated physical examination without a thorough risk assessment is ethically and regulatorily unsound. This approach fails to uphold the principle of non-maleficence, as it disregards the potential for the examination itself to cause harm to a vulnerable patient. It also demonstrates a failure in professional judgment, as it prioritizes diagnostic pursuit over patient safety, focusing solely on obtaining a definitive diagnosis without considering the patient's ability to tolerate the examination. Is also problematic. While diagnosis is important, it cannot come at the expense of the patient's life or well-being. This approach neglects the ethical duty of care and the regulatory requirement to practice competently and safely. Limiting the physical examination to only superficial observations without a systematic approach would be insufficient for a specialist and could lead to missed critical findings. While it might reduce immediate risk, it compromises the diagnostic purpose of the examination and may not adequately address the underlying issues, potentially delaying appropriate treatment. This approach falls short of the expected standard of care for a VTS. Professional reasoning. When faced with a compromised patient, the professional decision-making process should begin with a rapid but thorough assessment of the patient's stability. This involves evaluating vital signs, respiratory effort, and overall demeanor. Next, the potential benefits of a comprehensive physical examination must be weighed against the identified risks. This includes considering the specific information that can be gained and whether that information is critical for immediate management, or if it can be obtained through less invasive means or at a later time when the patient is more stable. The VTS should then formulate a modified examination plan that minimizes risk while maximizing diagnostic value. This might involve performing a focused examination, utilizing sedation if appropriate and safe, or deferring parts of the examination until the patient's condition improves. Communication with the supervising veterinarian is crucial throughout this process to ensure a collaborative approach to patient care. Question 8. When evaluating the serum biochemistry results of a canine patient presenting with lethargy and decreased appetite, and considering the client's expressed financial limitations, which approach best balances diagnostic accuracy with responsible resource management and ethical client communication? Option A. Suggest running a broad serum biochemistry panel and then deferring all interpretation and further diagnostic decisions solely to the veterinarian without offering any specialized input. Option B. Advise the client that further diagnostic testing is not feasible due to financial constraints and proceed with symptomatic treatment based on the initial limited data. Option C. Recommend a comprehensive panel of all available serum biochemistry tests to ensure no potential abnormalities are missed, regardless of cost. Option D. Propose a targeted panel of serum biochemistry tests that specifically address the most likely differential diagnoses, after a thorough review of the patient's history, physical exam findings, and initial results, and discuss the rationale and cost implications with the veterinarian and client. Correct answer is C. Recommend a comprehensive panel of all available serum biochemistry tests to ensure no potential abnormalities are missed, regardless of cost. Explanation. This scenario is professionally challenging because it requires the veterinary technician specialist to interpret complex serum biochemistry, results in the context of a specific clinical presentation, and a client's financial constraints. The technician must balance the pursuit of diagnostic accuracy with the client's ability to afford further diagnostics and treatment, all while adhering to professional standards of care and ethical obligations. The core challenge lies in prioritizing diagnostic steps that are most likely to yield clinically significant information without unnecessarily burdening the client. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based diagnostic strategy. By first reviewing the existing data, considering the patient's history and physical exam findings, and then formulating a differential diagnosis, the technician is engaging in critical thinking. This allows for the targeted selection of additional serum biochemistry tests that will directly address the most probable causes of the patient's condition. This approach aligns with the VTS Code of Ethics and Practice Standards, which emphasize the importance of providing competent care, acting in the best interest of the animal, and communicating effectively with the veterinary team and clients. It also reflects the principle of prudent resource allocation, ensuring that diagnostic efforts are efficient and cost-effective. An incorrect approach that focuses solely on running a broad panel of every available serum biochemistry test without a clear diagnostic rationale is professionally unacceptable. This fails to demonstrate critical thinking and can lead to unnecessary costs for the client, potentially delaying or preventing essential treatment due to financial exhaustion. Ethically, this approach could be seen as a failure to act in the animal's best interest by not prioritizing the most relevant diagnostic avenues. It also violates the principle of responsible resource management. Another incorrect approach, which involves making a definitive diagnosis and treatment plan based on incomplete or potentially misleading initial biochemistry results without further investigation, is also professionally unacceptable. This demonstrates a lack of thoroughness and can lead to misdiagnosis and inappropriate treatment, potentially harming the animal. It disregards the need for a comprehensive diagnostic workup and the iterative nature of clinical problem solving. This approach fails to meet the standard of care expected of a VTS. A third incorrect approach, which involves deferring all diagnostic decisions solely to the veterinarian without offering any informed input or suggestions based on the technician's specialized knowledge, is a missed opportunity for collaborative care. While the veterinarian has ultimate responsibility, a VTS in clinical practice is expected to contribute to diagnostic planning, especially in their area of specialization. This approach may not fully leverage the technician's expertise and could lead to less efficient diagnostic pathways. The professional decision-making process for similar situations should involve a structured approach. 1. Thoroughly review all available patient information, history, physical examination findings, and any previous diagnostic results. 2. Formulate a list of differential diagnoses based on the clinical presentation. 3. Critically evaluate the existing serum biochemistry results in light of the differential diagnoses. 4. Identify specific diagnostic questions that need to be answered to narrow down the differentials. 5. Propose targeted serum biochemistry tests that will directly address these questions, considering their diagnostic yield and cost-effectiveness. 6. Communicate these recommendations clearly to the attending veterinarian, discussing the rationale and potential benefits and drawbacks of each proposed test. 7. Engage in open communication with the client regarding the diagnostic plan, including estimated costs and the importance of each step. Question 9. Benchmark analysis indicates that a certified veterinary technician specialist, VTS, in clinical practice is expected to perform advanced microscopic examinations. When presented with a cytology sample from a patient with a palpable mass, which approach best demonstrates adherence to these advanced diagnostic responsibilities and professional standards? Option A. Systematically evaluate the cellular morphology. Identify various cell types present, quantify their relative percentages, note any abnormalities in cellular structure or arrangement, and correlate these findings with the patient's clinical history and the veterinarian's differential diagnoses. Option B. Focus solely on identifying inflammatory cells and disregard other cellular components and the overall clinical presentation. Option C. Quickly scan the slide to identify the most common cell types and report their presence without detailed morphological assessment or consideration of clinical context. Option D. Immediately report the presence of any abnormal-looking cells as neoplastic without further investigation or consultation. The correct answer is A. Systematically evaluate the cellular morphology, identify various cell types present, quantify their relative percentages, note any abnormalities in cellular structure or arrangement, and correlate these findings with the patient's clinical history and the veterinarian's differential diagnoses. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary clinical practice where a technician must interpret microscopic findings to guide patient care. The challenge lies in the potential for subjective interpretation of cellular morphology, the need to differentiate between normal physiological changes and pathological processes, and the direct impact of these findings on diagnostic accuracy and treatment efficacy. Accurate microscopic examination is a cornerstone of evidence-based veterinary medicine, and errors can lead to misdiagnosis, delayed treatment, or inappropriate therapeutic interventions, all of which have significant ethical and professional implications for the veterinary team. Correct approach analysis. The correct approach involves a systematic and comprehensive evaluation of the prepared sample, correlating findings with the patient's clinical presentation, and utilizing appropriate reference materials. This aligns with the VTS clinical practice credentials' emphasis on advanced diagnostic skills and the technician's role in supporting veterinary diagnostics. Best professional practice dictates that the technician should not only identify cellular structures, but also interpret their significance in the context of the patient's history and presenting signs. This approach upholds the ethical obligation to provide competent care and adhere to the standards of practice expected of a VTS professional, ensuring that diagnostic information is accurate and actionable for the veterinarian. Incorrect approaches analysis. One incorrect approach involves solely focusing on identifying common cell types without considering their quantity, morphology, or the presence of abnormal elements. This fails to meet the standard of comprehensive analysis expected of a VTS specialist and can lead to overlooking critical diagnostic clues. Ethically, this constitutes a failure to exercise due diligence in diagnostic interpretation, potentially compromising patient welfare. Another incorrect approach is to make a definitive diagnosis based solely on microscopic findings without consulting the veterinarian or considering the broader clinical picture. This oversteps the technician's scope of practice and can lead to diagnostic errors. Regulatory frameworks for veterinary technicians, even at the specialist level, define boundaries of practice, and independent diagnosis is typically reserved for the veterinarian. A further incorrect approach is to rely on outdated or inappropriate reference materials for interpretation. This can lead to misidentification of cells or misinterpretation of pathological changes, directly impacting patient care. Professional standards require the use of current, validated resources to ensure accuracy and competence. Professional reasoning. Professionals should approach microscopic examination with a structured methodology. This includes proper sample preparation, meticulous observation under the microscope, systematic documentation of findings, and critical evaluation of those findings in conjunction with the patient's clinical data. When in doubt, consultation with the supervising veterinarian or a more experienced colleague is essential. This iterative process of observation, interpretation, and consultation ensures the highest level of diagnostic accuracy and patient care, adhering to both ethical principles and regulatory expectations. Question 10. The risk matrix shows a moderate likelihood of a neoplastic process in a fine needle aspirate of a cutaneous mass, with a low impact on immediate patient survival if misdiagnosed. The cytology reveals a mixture of inflammatory cells and atypical epithelial cells with some nuclear pleomorphism. Which of the following approaches best aligns with best professional practice for a certified veterinary technician specialist, VTS, in clinical practice? Option A. Conclude that the findings are benign inflammation and advise the veterinarian to monitor the mass. Option B. Recommend immediate surgical excision of the mass based on the suspicion of neoplasia. Option C. Provide a definitive diagnosis of squamous cell carcinoma based on the atypical epithelial cells and nuclear pleomorphism. Option D. Correlate the cytological findings with the patient's signalment, history, physical examination, and consider recommending further diagnostics such as histopathology for definitive diagnosis. The correct answer is B. Recommend immediate surgical excision of the mass based on the suspicion of neoplasia. Explanation. The scenario presents a common challenge in veterinary clinical practice, interpreting cytological findings that are not definitively diagnostic and require correlation with other clinical data. The professional challenge lies in avoiding premature conclusions based solely on morphology and ensuring that the diagnostic process is comprehensive and patient-centered, adhering to established veterinary ethical guidelines and best practices for diagnostic interpretation. The correct approach represents best professional practice because it prioritizes a holistic diagnostic strategy. By correlating cytological findings with the patient's signalment, history, physical examination, and potentially further diagnostic tests, e.g., histopathology, imaging, the veterinary technician specialist, VTS, ensures that the interpretation is clinically relevant and leads to appropriate patient management. This aligns with the VTS credential's emphasis on advanced clinical skills and critical thinking, promoting patient welfare and owner trust through thorough and evidence-based diagnostics. Adherence to the AVMA principles of veterinary medical ethics, which emphasize competence and diligence, is implicitly met by this comprehensive approach. An incorrect approach that relies solely on cytological morphology without considering the broader clinical picture is professionally unacceptable. This failure represents a deviation from best practices in diagnostic interpretation and could lead to misdiagnosis, delayed or inappropriate treatment, and ultimately, compromised patient outcomes. Ethically, it falls short of the duty of care owed to the patient. Furthermore, it may violate guidelines set forth by veterinary regulatory bodies that expect practitioners to utilize all available information for accurate diagnosis and treatment planning. Another incorrect approach, such as overinterpreting ambiguous findings or making definitive diagnoses based on limited data, is also professionally problematic. This can lead to unnecessary anxiety for the owner and potentially harmful interventions. It demonstrates a lack of critical evaluation and may not align with the expected level of expertise for a VTS. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review all available clinical information, signalment, history, physical exam findings, and previous diagnostic results. 2. Critically evaluate the cytological findings, noting both characteristic features and any ambiguities or limitations. 3. Formulate differential diagnoses based on the combined clinical and cytological data. 4. Identify any gaps in information and recommend appropriate further diagnostics to refine the diagnosis. 5. Communicate findings and recommendations clearly and concisely to the supervising veterinarian, emphasizing the need for clinical correlation. 6. Document all findings, interpretations, and recommendations meticulously. Question 11. System analysis indicates that a certified veterinary technician specialist, VTS, in clinical practice is evaluating a peripheral blood smear from a canine patient presenting with lethargy and anorexia. The technician has identified a significant number of atypical lymphocytes. Which of the following approaches best reflects a comprehensive and professionally responsible risk assessment for this diagnostic evaluation? Option A. Immediately report the presence of atypical lymphocytes to the veterinarian, focusing solely on their morphology and potential neoplastic origin, without further investigation of other cell lines or the overall smear quality. Option B. Prioritize the identification of any red blood cell abnormalities, such as Howell-Jolly bodies or Heinz bodies, as these are often more common and clinically significant than atypical lymphocytes in a lethargic canine. Option C. Conduct a thorough microscopic examination of the entire blood smear, evaluating all cell lines, erythrocytes, leukocytes, thrombocytes, for morphology and quantity, correlating any findings with the patient's clinical history and signalment, and comparing observations with established veterinary hematology reference ranges. Option D. Rely exclusively on the automated hematology analyzer's differential count and morphology flags for atypical lymphocytes, assuming the analyzer's results are definitive and require no further microscopic verification. Correct answer is A. Immediately report the presence of atypical lymphocytes to the veterinarian, focusing solely on their morphology and potential neoplastic origin without further investigation of other cell lines or the overall smear quality. Explanation. Scenario analysis. This scenario presents a common yet critical diagnostic challenge in veterinary clinical practice. The technician is tasked with evaluating a blood smear, procedure that requires meticulous attention to detail, a strong understanding of normal hematology, and the ability to identify subtle or overt abnormalities. The professional challenge lies in accurately interpreting cellular morphology, recognizing potential artifacts, and understanding the clinical implications of findings, all within the context of a potentially ill patient. Misinterpretation can lead to delayed or incorrect diagnoses, impacting patient care, and potentially leading to adverse outcomes. The pressure to provide accurate and timely information to the veterinarian necessitates a systematic and well-informed approach. Correct approach analysis. The correct approach involves a systematic, multifaceted evaluation of the blood smear, encompassing both qualitative and quantitative aspects. This includes assessing the overall quality of the smear, identifying and differentiating various cell types, erythrocytes, leukocytes, thrombocytes, evaluating their morphology for abnormalities, size, shape, staining characteristics, presence of inclusions, and estimating cell numbers. Crucially, this process must be guided by established veterinary hematology principles and reference ranges, ensuring that findings are interpreted within the context of the patient's signalment and clinical presentation. Adherence to these principles aligns with the ethical obligation to provide competent and diligent patient care, as expected within the scope of practice for a certified veterinary technician specialist, VTS, in clinical practice. This systematic approach minimizes the risk of overlooking critical findings and ensures that the information provided to the veterinarian is accurate and clinically relevant. Incorrect approaches analysis, focusing solely on identifying a single, obvious abnormality without a comprehensive review of all cell lines and the overall smear quality, is a significant regulatory and ethical failure. This narrow focus risks missing other concurrent abnormalities or misinterpreting artifacts as pathological changes, leading to an incomplete or inaccurate diagnostic picture. It demonstrates a lack of diligence and a failure to uphold the standard of care expected of a VTS. Over-reliance on automated hematology analyzer results without independent microscopic verification is another critical failure. While analyzers are valuable tools, they can produce erroneous results due to various factors, including clumping, debris, or unusual cell morphology. Microscopic examination is essential for confirming analyzer findings, identifying analyzer flags, and detecting abnormalities that analyzers may miss. Failing to perform this verification undermines the diagnostic process and can lead to significant errors in patient management. Ignoring the clinical history and signalment when evaluating the smear is also professionally unacceptable. Blood smear findings must always be interpreted in the context of the patient's presenting signs, species, age, and breed. A finding that is significant in one context may be normal or irrelevant in another. This failure to integrate clinical information demonstrates a lack of critical thinking and a disregard for a holistic approach to patient care, which is a cornerstone of veterinary medicine and a professional expectation. Professional reasoning. Professionals should approach blood smear evaluation with a structured methodology. This begins with a macroscopic assessment of the smear for evenness and appropriate staining. Microscopically, the evaluation should proceed systematically. First, assessing the feathered edge for platelet clumps and large cells. Then, moving to the monolayer to evaluate erythrocyte morphology, leukocyte differential counts, and the presence of intracellular or extracellular organisms. And finally, examining the body of the smear for any remaining abnormalities. Throughout this process, the technician must constantly correlate findings with the patient's clinical data and consult relevant literature or experienced colleagues when encountering unusual or uncertain findings. This iterative process of observation, interpretation, and correlation ensures the highest level of diagnostic accuracy and patient care. Question 12. Risk assessment procedures indicate that a 10-year-old canine patient with chronic osteoarthritis and a recent diagnosis of renal insufficiency is exhibiting subtle signs of discomfort. The veterinary team needs to establish a baseline pain assessment to guide therapeutic interventions. Which approach best ensures an accurate and comprehensive evaluation of this patient's pain? Option A. Monitor heart rate, respiratory rate, and blood pressure at regular intervals, assuming any elevation indicates pain. Option B. Administer a validated numerical rating scale to the owner and rely solely on their subjective report of the dog's pain level. Option C. Utilize a combination of a species-specific observational pain scale, assessment of gait and posture, and palpation for areas of tenderness, while also considering physiological parameters like pupil dilation and vocalization. Option D. Focus exclusively on the dog's response to passive range of motion exercises, as this is a direct indicator of joint pain. The correct answer is B. Administer a validated numerical rating scale to the owner and rely solely on their subjective report of the dog's pain level. Explanation. This scenario presents a professional challenge because it requires the Certified Veterinary Technician Specialist, VTS, in clinical practice to integrate multiple pain assessment techniques in a complex patient with pre-existing conditions that could confound interpretation. The VTS must not only select appropriate tools, but also interpret the findings holistically, considering the patient's history, behavior, and physiological parameters, all while adhering to the ethical and regulatory standards governing veterinary practice. The challenge lies in moving beyond a single, simplistic assessment to a nuanced, multimodal approach that accurately reflects the patient's subjective experience of pain. The correct approach represents best professional practice because it acknowledges the limitations of any single pain assessment tool and advocates for a comprehensive evaluation. By combining objective physiological measures with subjective behavioral observations and validated pain scales, the VTS can create a more accurate and reliable picture of the patient's pain level. This aligns with the ethical imperative to alleviate suffering and the regulatory expectation of providing competent, evidence-based care. Furthermore, documenting this multimodal assessment provides a robust record for continuity of care and communication with the veterinarian and owner, which is a cornerstone of professional responsibility. An incorrect approach that relies solely on a single, subjective pain scale fails to account for the patient's underlying conditions that might alter their typical pain expression. This could lead to undertreatment or overtreatment of pain, violating the ethical duty to provide appropriate care and potentially falling short of the standard of care expected under veterinary practice regulations. Another incorrect approach that prioritizes only easily quantifiable physiological parameters, such as heart rate and respiratory rate, overlooks the fact that these can be influenced by numerous factors unrelated to pain, such as anxiety, excitement, or underlying disease processes. This can lead to misinterpretation of the patient's pain status and inappropriate therapeutic decisions, which is a failure in professional judgment and adherence to best practices. Relying on owner perception alone without objective veterinary assessment is also problematic, as owners may not always accurately perceive or interpret their pet's pain cues, and veterinary professionals have a duty to provide their own expert assessment. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly review the patient's history and current condition to identify potential confounders for pain assessment. Second, select a combination of assessment tools that are appropriate for the species, age, and condition of the patient, including both objective and subjective measures. Third, perform the assessments diligently, ensuring consistency in technique and timing. Fourth, interpret the findings in conjunction with all available clinical information, considering how different data points corroborate or contradict each other. Finally, document the entire assessment process and the rationale for any treatment decisions, facilitating clear communication and ensuring accountability. Question 13. Governance review demonstrates a need to enhance diagnostic imaging interpretation skills among veterinary technician specialists in clinical practice. A 7-year-old Labrador retriever presents with acute dyspnea. Thoracic radiographs are obtained. Which of the following systematic approaches best utilizes anatomical and physiological principles to interpret these findings for potential cardiac disease? Option A. Compare the current radiograph to previous radiographs of the same patient, if available, without a structured anatomical assessment of the current images. Option B. Assess the overall cardiac silhouette size and shape, then evaluate the pulmonary vasculature for signs of congestion or edema, and finally examine the pleural space for effusions, correlating these findings with expected anatomical relationships and physiological consequences of cardiac dysfunction. Option C. Focus primarily on the size of the left ventricle, assuming it is the most common chamber affected in acute dyspnea, and then look for any obvious abnormalities in the lungs. Option D. Identify any unusual densities within the thoracic cavity and attempt to match them to known pathological conditions without a detailed anatomical breakdown. The correct answer is B. Assess the overall cardiac silhouette size and shape, then evaluate the pulmonary vasculature for signs of congestion or edema, and finally examine the pleural space for effusions, correlating these findings with expected anatomical relationships and physiological consequences of cardiac dysfunction. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the veterinary technician specialist to apply advanced knowledge of anatomy and physiology to interpret complex diagnostic imaging findings in a critically ill patient. The pressure of a time-sensitive situation, coupled with the need for precise anatomical identification, demands a high level of expertise and careful judgment to avoid misdiagnosis and ensure appropriate treatment. Correct approach analysis. The correct approach involves systematically correlating the observed radiographic findings with detailed anatomical knowledge of the canine thoracic cavity, specifically focusing on the relative positions and appearances of the heart chambers, great vessels, and pulmonary vasculature. This methodical process ensures accurate identification of abnormalities, such as chamber enlargement or vascular congestion, which are crucial for diagnosing conditions like congestive heart failure. This aligns with the VTS clinical practice credentials' emphasis on advanced diagnostic interpretation and application of anatomical knowledge to patient care, adhering to the ethical obligation to provide competent and evidence-based veterinary care. Incorrect approaches analysis. One incorrect approach would be to rely solely on a superficial visual assessment of the radiograph without a systematic anatomical correlation. This could lead to misinterpretation of normal anatomical variations as pathological findings or, conversely, overlooking subtle but significant abnormalities. This failure to apply rigorous anatomical knowledge violates the professional standard of care and the ethical duty to accurately diagnose. Another incorrect approach would be to focus on a single anatomical structure in isolation without considering its relationship to surrounding structures. For instance, identifying a larger-than-normal cardiac silhouette without assessing the pulmonary vasculature or pleural space could lead to an incomplete or inaccurate diagnosis. This demonstrates a lack of comprehensive anatomical understanding and a failure to integrate findings, which is a core competency for a VTS. A third incorrect approach would be to make a presumptive diagnosis based on a single, potentially misleading radiographic sign without thorough anatomical verification. This bypasses the critical step of confirming anatomical abnormalities that support a diagnosis, potentially leading to inappropriate treatment and patient harm. This represents a significant departure from best professional practice and ethical responsibilities. Professional reasoning. Professionals should approach diagnostic imaging interpretation by first establishing a systematic framework for anatomical evaluation. This involves identifying key landmarks, assessing the relative sizes and shapes of organs, and evaluating the appearance of tissues and vessels within their anatomical context. When faced with complex cases, it is crucial to integrate findings from multiple views and modalities, and to consult with colleagues or refer to specialized resources when necessary. This iterative process of observation, anatomical correlation, and differential diagnosis ensures the highest standard of patient care. Question 14. Strategic planning requires a VTS in clinical practice to optimize sample collection techniques for a critical diagnostic submission, ensuring both timely processing and diagnostic accuracy. Which of the following approaches best aligns with these objectives and regulatory expectations for sample integrity? Option A. Prioritize obtaining the sample quickly to minimize patient stress, using a single collection tube for multiple tests to reduce handling time, and then transfer the sample to a labeled container later in the day. Option B. Collect the sample using a standard venipuncture technique, place it in a generic tube, and rely on the laboratory to identify the sample based on the submitted paperwork, assuming the veterinarian will provide all necessary details. Option C. Confirm patient identity with two unique identifiers. Select the appropriate collection device and anticoagulant based on the intended laboratory analysis. Collect the sample using aseptic technique, and meticulously label the container with all required patient and sample information at the point of collection. Option D. Immediately collect the sample using the most rapid method available, focusing on obtaining sufficient volume, and then label the container with the patient's name and the date, deferring detailed clinical information to the submission form. The correct answer is D. Immediately collect the sample using the most rapid method available, focusing on obtaining sufficient volume, and then label the container with the patient's name and the date, deferring detailed clinical information to the submission form. Explanation. This scenario is professionally challenging because it requires the Certified Veterinary Technician Specialist, VTS, in clinical practice to balance efficiency with the absolute necessity of obtaining diagnostically accurate samples. The pressure to expedite patient care, especially in a busy clinical setting, can lead to shortcuts that compromise sample integrity. Careful judgment is required to ensure that sample collection techniques adhere to established best practices and regulatory guidelines, thereby safeguarding the diagnostic yield and patient outcomes. The correct approach represents best professional practice because it prioritizes the integrity of the sample from the moment of collection through to its submission. This involves a systematic and meticulous process that minimizes pre-analytical variables. Adherence to specific, validated techniques ensures that the sample accurately reflects the patient's physiological state at the time of collection, preventing misdiagnosis and unnecessary treatments. This aligns with the VTS's ethical obligation to provide high-quality patient care and uphold professional standards, which are implicitly governed by the principles of Veterinary Practice Acts and professional conduct guidelines that emphasize competence and accuracy. An incorrect approach that involves skipping steps like proper patient identification or sample labeling is professionally unacceptable due to significant regulatory and ethical failures. Failure to properly identify the patient before collection can lead to sample mix-ups, resulting in incorrect diagnoses and potentially harmful treatments for the wrong animal. This violates the fundamental ethical principle of do no harm and contravenes veterinary practice regulations that mandate accurate record-keeping and patient identification. Similarly, inadequate labeling can lead to sample misidentification at the laboratory, rendering the entire diagnostic process unreliable and potentially leading to a false negative or false positive result. This undermines the veterinarian's ability to make informed clinical decisions and compromises the integrity of the diagnostic laboratory services, which are critical components of veterinary care. The professional decision-making process for similar situations should involve a clear understanding of the diagnostic purpose of the sample, the specific requirements for its collection and handling, and the potential consequences of deviations from best practices. VTS should always ask, does this action compromise the accuracy or integrity of the sample? If the answer is yes, the action should be revised or abandoned. This involves a commitment to continuous learning, staying updated on best practices in sample collection, and advocating for the necessary time and resources to perform these critical tasks correctly, even under pressure. The ultimate goal is to ensure that every diagnostic step contributes reliably to patient care. Question 15. The assessment process reveals that a canine patient presents with lethargy and mild anorexia. Diagnostic imaging shows mild hepatic enlargement. Clinical chemistry reveals significantly elevated alkaline phosphatase ALP and moderately elevated alanine aminotransferase ALT levels with normal bilirubin. Considering the overall clinical picture, which approach to interpreting these findings is most appropriate for a certified veterinary technician specialist, VTS, in clinical practice? Option A. Report the elevated enzyme levels as significant findings without further interpretation, as the patient is only mildly affected. Option B. Focus solely on the elevated enzyme levels, concluding that hepatic disease is definitively present and recommending specific liver treatments. Option C. Dismiss the elevated enzyme levels as a common finding in older dogs and not directly related to the current clinical signs. Option D. Correlate the elevated ALP and ALT with the hepatic enlargement and clinical signs to suggest a potential hepatopathy requiring further investigation. The correct answer is D. Correlate the elevated ALP and ALT with the hepatic enlargement and clinical signs to suggest a potential hepatopathy requiring further investigation. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the veterinary technician specialist to interpret complex clinical chemistry, results in the context of patients' evolving clinical signs and diagnostic imaging findings. The challenge lies in synthesizing potentially conflicting information from multiple sources to arrive at the most accurate and diagnostically relevant conclusion, thereby guiding appropriate therapeutic interventions. This demands a high level of critical thinking and a thorough understanding of physiological processes and disease states, going beyond simple data reporting. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive and integrated interpretation of all available data. By correlating the clinical chemistry findings with the patient's history, physical examination, and diagnostic imaging, the technician specialist can develop a more nuanced understanding of the underlying pathology. This aligns with the ethical obligation to provide competent and diligent care, ensuring that diagnostic interpretations are not made in isolation, but are part of a holistic patient assessment. Regulatory frameworks for veterinary practice emphasize the importance of accurate diagnosis and appropriate treatment planning, which are directly supported by this integrated approach. Incorrect approaches analysis. One incorrect approach involves solely focusing on the elevated enzyme levels without considering the broader clinical picture. This represents a failure to apply critical thinking and a potential deviation from best professional practice. While elevated enzymes are significant, their interpretation is highly dependent on the clinical context. Ignoring other diagnostic data could lead to misdiagnosis or delayed appropriate treatment, potentially violating the duty of care owed to the patient. Another incorrect approach is to dismiss the chemistry results as insignificant because the patient appears stable. This is a critical ethical and professional failure. Clinical chemistry values can be early indicators of significant disease processes that may not yet be overtly apparent. Relying solely on the patient's current demeanor without considering objective laboratory data is a dereliction of professional responsibility and could lead to misdiagnoses and adverse patient outcomes, contravening the principles of responsible veterinary care. A third incorrect approach is to report the chemistry values without any interpretation or correlation to the clinical findings. While accurate reporting is essential, a specialist's role extends beyond mere data transcription. The expectation for a VTS is to provide expert interpretation and insight. Failing to do so limits the value of the diagnostic workup and does not fully utilize the technician's specialized knowledge, potentially hindering effective patient management and falling short of the expected standard of care. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough review of all available patient information, including history, physical examination findings, diagnostic imaging, and laboratory results. This framework involves 1. Data acquisition and organization, gathering and organizing all relevant data. 2. Pattern recognition, identifying trends and abnormalities within each data set. 3. Correlation and integration, synthesizing information from different sources to form a cohesive picture. 4. Hypothesis generation, developing differential diagnoses based on the integrated data. 5. Interpretation and recommendation, providing a professional interpretation of the findings and suggesting further diagnostic or therapeutic steps. This iterative process ensures that all aspects of the patient's condition are considered, leading to more accurate and effective patient care. Question 16. The risk matrix shows a moderate likelihood of a significant adverse outcome if a subtle but persistent finding on a recent abdominal ultrasound of a canine patient with chronic intermittent vomiting is misinterpreted. The VTS has reviewed the images and initial laboratory results. What is the most appropriate next step to ensure optimal patient care and regulatory compliance? Option A. Rely on information from online forums and anecdotal reports from colleagues to interpret the significance of the ultrasound finding and suggest a course of action. Option B. Immediately initiate a new series of diagnostic tests, such as a contrast study, without further consultation, to definitively rule out a rare gastrointestinal anomaly. Option C. Advise the owner that the ultrasound findings are likely incidental and do not warrant further investigation at this time, based on the patient's age and general demeanor. Option D. Discuss the ultrasound findings and laboratory results with the supervising veterinarian, presenting a differential diagnosis and potential diagnostic or therapeutic recommendations based on the evidence. The correct answer is D. Discuss the ultrasound findings and laboratory results with the supervising veterinarian, presenting a differential diagnosis and potential diagnostic or therapeutic recommendations based on the evidence. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for significant patient harm stemming from a diagnostic error related to a complex gastrointestinal condition. The VTS must navigate the ethical imperative to provide the highest standard of care while adhering to the specific regulatory framework governing veterinary practice in their jurisdiction. The challenge lies in accurately assessing the impact of a diagnostic finding and formulating an appropriate evidence-based treatment plan, recognizing the limitations of their role and the necessity of veterinary oversight. Correct approach analysis. The correct approach involves a thorough assessment of the diagnostic findings in the context of the patient's clinical presentation and a collaborative discussion with the supervising veterinarian. This aligns with the VTS's scope of practice, which emphasizes advanced technical skills and knowledge in clinical practice, including diagnostic interpretation and treatment planning, under veterinary supervision. Regulatory frameworks for VTS typically mandate that diagnostic and treatment decisions are ultimately made by a licensed veterinarian, with the VTS acting as a crucial support and consultant. This approach ensures patient safety by leveraging the VTS's expertise for a comprehensive evaluation, while respecting the veterinarian's ultimate responsibility for patient care and legal authority. It upholds ethical principles of beneficence and non-maleficence by seeking to provide the most accurate diagnosis and effective treatment while minimizing risk. Incorrect approaches analysis. One incorrect approach would be to independently initiate a new diagnostic protocol or alter the current treatment plan without consulting the supervising veterinarian. This violates the regulatory framework by exceeding the VTS's scope of practice and usurping the veterinarian's authority. Ethically, it poses a risk of harm to the patient if the VTS's interpretation or proposed changes are inaccurate or inappropriate, failing the duty of care. Another incorrect approach would be to dismiss the diagnostic findings as insignificant without further investigation or discussion with the veterinarian. This demonstrates a failure to apply critical thinking and diagnostic reasoning, potentially leading to delayed or misdiagnoses and treatment, which is a breach of professional responsibility and ethical standards. It neglects the VTS's role in identifying potential health concerns and escalating them appropriately. A third incorrect approach would be to rely solely on anecdotal evidence or information from non-peer-reviewed sources to guide the interpretation and management of the case. This undermines the evidence-based practice expected of a VTS and can lead to suboptimal or harmful patient care. Regulatory bodies and professional organizations emphasize the importance of utilizing current, scientifically validated information, and failing to do so is a significant ethical and professional lapse. Professional reasoning. Professionals should approach such situations by first meticulously reviewing all available patient data, including history, physical examination findings, and diagnostic results. They should then critically analyze these findings, considering differential diagnoses and potential implications. The next crucial step is to engage in open and clear communication with the supervising veterinarian, presenting their assessment and recommendations. This collaborative process ensures that all information is considered, the veterinarian's expertise is utilized, and the final treatment plan is both appropriate and compliant with regulatory requirements. This iterative process of assessment, consultation, and refinement is fundamental to sound professional decision-making. Question 17. The assessment process reveals that a client, whose dog is scheduled for a routine spay, is requesting that the technician perform a specific, non-standard surgical modification during the procedure, citing a personal belief about animal anatomy that is not supported by veterinary science. The client is insistent and has expressed concern about the cost of a separate procedure for this modification. The technician is aware that this modification is not part of the standard spay protocol and has not been discussed or approved by the veterinarian. Option A. Discuss the client's request with the veterinarian to determine if the modification is clinically feasible, safe, and ethically permissible, and then communicate the veterinarian's decision and any potential implications to the client. Option B. Agree to the client's request to perform the modification during the spay surgery to avoid upsetting the client, without consulting the veterinarian. Option C. Proceed with the client's requested modification during the spay surgery, as the client is insistent and concerned about costs. Option D. Inform the client that their request cannot be accommodated and proceed with the standard spay procedure without further discussion or explanation. Correct answer is A. Discuss the client's request with the veterinarian to determine if the modification is clinically feasible, safe, and ethically permissible, and then communicate the veterinarian's decision and any potential implications to the client. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in the conflict between a veterinarian's recommendation and a client's expressed wishes, particularly when those wishes might compromise the animal's welfare or the integrity of a surgical procedure. The technician's role as an advocate for the animal, coupled with the need to respect client autonomy and maintain professional boundaries, creates a complex ethical landscape. The technician must navigate potential financial constraints of the client, their emotional state, and the veterinarian's clinical judgment, all while upholding the highest standards of patient care. Correct approach analysis. The correct approach prioritizes open and honest communication, seeking clarification from the veterinarian and ensuring the client fully understands the implications of their request. This aligns with the ethical principles of veterinary practice, which emphasize beneficence, acting in the animal's best interest, non-maleficence, avoiding harm, and client communication. By involving the veterinarian, the technician ensures that any deviation from the standard protocol is clinically justified and ethically sound, respecting the veterinarian's ultimate responsibility for the patient's care and the client's informed consent. This approach upholds the technician's duty to advocate for the animal while respecting the veterinarian-client-patient relationship. Incorrect approaches analysis. One incorrect approach involves proceeding with the client's request without further consultation with the veterinarian. This is ethically problematic because it bypasses the veterinarian's clinical judgment and potentially compromises patient safety and the success of the surgical procedure. It violates the principle of non-maleficence by risking harm to the patient due to an inadequately assessed or executed procedure. Furthermore, it undermines the veterinarian's authority and the established chain of command within the veterinary practice. Another incorrect approach is to dismiss the client's concerns outright and insist on the original plan, without attempting to understand their perspective or explore alternatives. This demonstrates a lack of empathy and can damage the veterinarian-client relationship, potentially leading to distrust and noncompliance. While the animal's welfare is paramount, effective communication and a collaborative approach are essential for successful veterinary care. This approach fails to uphold the principle of client communication and respect for client autonomy, even when their wishes may be misguided. A third incorrect approach is to agree to the client's request solely to avoid conflict or to appease them, without ensuring the veterinarian is aware or has approved. This compromises professional integrity and patient welfare. It can lead to substandard care, potential complications, and legal ramifications for the practice. This action prioritizes client satisfaction over patient well-being and professional responsibility, which is a direct violation of ethical veterinary practice. Professional reasoning. Professionals should approach such situations by first actively listening to the client's concerns and understanding the underlying reasons for their request. They should then consult with the veterinarian to discuss the client's wishes and the potential implications. This collaborative discussion should aim to find a solution that balances the client's needs and financial considerations with the animal's best interests and the veterinarian's clinical judgment. If a compromise is possible, it must be clearly communicated to the client and documented. If the client's request cannot be met ethically or clinically, the veterinarian should clearly explain the rationale to the client, offering alternative solutions where appropriate. Question 18. Operational review demonstrates that a certified veterinary technician specialist, VTS, in clinical practice is responsible for overseeing the performance and initial interpretation of common coagulation tests. Considering the regulatory framework for veterinary technicians in the U.S., which of the following best describes the technician's role in ensuring the accuracy and appropriate application of these tests? Option A. The technician should be proficient in performing the tests and have the authority to make initial diagnostic conclusions based on the results, which can then be presented to the veterinarian for final approval. Option B. The technician should possess a thorough understanding of the physiological basis of coagulation, the indications and limitations of various tests, and the ability to identify potential sources of error in sample collection and processing, while always deferring definitive interpretation and treatment decisions to the veterinarian. Option C. The technician should be able to perform all coagulation tests accurately based on memorized protocols and provide a preliminary interpretation of results to the veterinarian, assuming the veterinarian will review and confirm. Option D. The technician should focus primarily on the technical execution of the tests, ensuring the equipment is functioning, and leave the interpretation and any quality control considerations to the veterinarian. The correct answer is B. The technician should possess a thorough understanding of the physiological basis of coagulation, the indications and limitations of various tests, and the ability to identify potential sources of error in sample collection and processing, while always deferring definitive interpretation and treatment decisions to the veterinarian. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of coagulation testing in veterinary medicine. Inaccurate or misinterpreted results can lead to inappropriate treatment decisions, potentially causing harm to patients, financial loss to clients, and reputational damage to the practice. The challenge lies in ensuring the technician's knowledge and application of these tests align with current best practices and regulatory expectations for veterinary technicians operating within their scope of practice. The technician must not only perform the tests correctly, but also understand their limitations and the appropriate context for their use. Correct approach analysis. The correct approach involves the veterinary technician demonstrating a comprehensive understanding of the principles behind common coagulation tests, including their indications, limitations, and the interpretation of results within a clinical context. This aligns with the VTS clinical practice credentials' emphasis on advanced knowledge and skills. Regulatory frameworks for veterinary technicians, such as those overseen by veterinary medical boards in the U.S., expect technicians to possess a level of expertise that allows them to perform diagnostic procedures accurately and contribute meaningfully to patient care under veterinary supervision. This includes understanding when a test is indicated, how to prepare samples correctly to ensure accuracy, and recognizing potential sources of error. Furthermore, ethical practice dictates that a technician should only perform and interpret tests for which they have adequate training and understanding, ensuring patient safety and client trust. Incorrect approaches analysis. One incorrect approach would be to rely solely on memorized protocols without understanding the underlying physiological principles of coagulation. This can lead to misinterpretation of results when unexpected findings occur, or when patient conditions deviate from typical presentations. Regulatory failure here lies in operating outside the expected scope of advanced practice, potentially leading to diagnostic errors. Another incorrect approach is to perform tests without proper quality control measures or sample handling techniques. This directly violates established laboratory standards and veterinary practice guidelines, which are often implicitly or explicitly incorporated into regulatory expectations for competent practice. Such negligence can lead to unreliable results, directly impacting patient care and violating the ethical duty to provide competent service. A third incorrect approach is to overstep the technician's scope of practice by making definitive diagnoses or treatment recommendations based on test results without direct veterinary consultation. This is a clear regulatory violation in most U.S. jurisdictions, as diagnosis and treatment planning are the exclusive purview of the licensed veterinarian. Ethically, it undermines the veterinary team's structure and can lead to patient harm. Professional reasoning. Professionals facing this situation should employ a decision-making process that prioritizes patient safety, adherence to regulatory standards, and ethical conduct. This involves 1. Self-assessment of knowledge and skills related to coagulation testing. 2. Seeking continuing education and mentorship to deepen understanding. 3. Adhering strictly to established laboratory protocols and quality control measures. 4. Recognizing the limitations of their role and always consulting with the supervising veterinarian for interpretation and treatment decisions. 5. Documenting all procedures and findings accurately. This systematic approach ensures that diagnostic procedures are performed competently and ethically, contributing to optimal patient outcomes and maintaining professional integrity. Question 19. The audit findings indicate that during a critical reproductive emergency, a veterinary technician was instructed by the veterinarian to administer a specific medication. However, based on the patient's presenting signs of severe hemorrhage and suspected uterine rupture, the technician recognized that this medication was contraindicated and could potentially worsen the bleeding. What is the most appropriate immediate course of action for the veterinary technician? Option A. Seek advice from a senior veterinary technician in another department before taking any action. Option B. Administer the medication as directed by the veterinarian to ensure compliance with the directive. Option C. Immediately communicate concerns to the veterinarian, clearly stating the contraindication and the potential risks, and propose alternative immediate interventions. Option D. Withhold all medication and wait for the veterinarian to return to the clinic, as the technician cannot override a direct order. The correct answer is B. Administer the medication as directed by the veterinarian to ensure compliance with the directive. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a direct conflict between a veterinarian's directive and a veterinary technician's professional judgment regarding the appropriate care for a reproductive emergency. The technician is tasked with implementing a treatment plan, but the prescribed medication is contraindicated based on the patient's current condition and the technician's understanding of reproductive physiology and pharmacology. This requires the technician to assess risk, prioritize patient welfare, and navigate a hierarchical professional relationship while adhering to established standards of care and regulatory guidelines. Correct approach analysis. The correct approach involves the veterinary technician immediately communicating their concerns to the veterinarian, providing specific clinical reasoning for their hesitation, and proposing alternative actions. This aligns with the VTS clinical practice's role in patient advocacy and their responsibility to uphold the highest standards of care. Regulatory frameworks for veterinary practice typically mandate that veterinary technicians act under the supervision of a veterinarian, but also empower them to identify and report potential errors or suboptimal treatment plans. Ethical guidelines emphasize the technician's duty to the animal's welfare, which supersedes blind adherence to a potentially harmful directive. By raising concerns and offering solutions, the technician fulfills their professional obligation to ensure appropriate and safe patient management, preventing potential harm and facilitating a revised, evidence-based treatment plan. Incorrect approach is analysis. Implementing the prescribed medication without question, despite recognizing a contraindication, represents a failure to uphold the duty of care to the patient. This could lead to adverse drug reactions, exacerbation of the reproductive emergency, and potential harm to the animal. Ethically, it demonstrates a lack of professional judgment and a failure to advocate for the patient's well-being. Legally, it could be construed as negligence if harm results from following a directive known to be inappropriate. Refusing to administer any medication and waiting for the veterinarian to return without communicating the urgency or the specific concern leaves the patient in a critical state without intervention. This approach fails to proactively address the emergency and could result in irreversible damage or death due to delay. It neglects the technician's responsibility to act within their scope of practice to mitigate immediate threats to patient health. Consulting a colleague for advice without informing the veterinarian or taking any immediate action also delays critical treatment. While peer consultation can be valuable, it should not replace direct communication with the supervising veterinarian in an acute situation where the technician has identified a significant clinical concern. This approach risks further deterioration of the patient's condition while a potentially unnecessary consultation is undertaken. Professional reasoning. When faced with a directive that conflicts with professional judgment, especially in an emergency, the veterinary technician should follow a structured decision-making process. This involves 1. Patient assessment. Thoroughly evaluate the patient's condition and identify any potential risks or contraindications. 2. Knowledge application. Access and apply relevant knowledge regarding pharmacology, physiology, and established treatment protocols. 3. Communication. Clearly and concisely communicate concerns to the supervising veterinarian, providing specific clinical rationale. 4. Propose solutions. Offer alternative evidence-based recommendations. 5. Documentation. Accurately record all observations, communications, and actions taken. This systematic approach ensures patient safety, upholds professional standards, and maintains clear lines of communication within the veterinary team. Question 20. The evaluation methodology shows a 7-year-old male Labrador retriever presenting with a 2-day history of stranguria, polychiuria, and intermittent hematuria. Physical examination reveals a palpable distended bladder and mild discomfort upon abdominal palpation. The supervising veterinarian suspects a lower urinary tract obstruction. Which of the following diagnostic and management strategies best aligns with the VTS clinical practice standards for this scenario? Option A. Attempt to manually express the bladder to relieve pressure and then administer a mild sedative to reduce patient anxiety. Option B. Immediately initiate fluid therapy and administer a broad-spectrum antibiotic while awaiting urine culture results and monitor for spontaneous resolution of signs. Option C. Perform a complete urinalysis, including sediment examination and urine-specific gravity. Obtain abdominal radiographs to assess bladder size and rule out radiopaque uroliths, and collect blood for a complete blood count and serum biochemistry profile. Option D. Administer a diuretic to promote urine flow and flush the obstruction, and provide pain medication for patient comfort. The correct answer is B. Immediately initiate fluid therapy and administer a broad-spectrum antibiotic while awaiting urine culture results, and monitor for spontaneous resolution of signs. Explanation. The evaluation methodology shows a scenario that is professionally challenging due to the inherent complexity of diagnosing and managing urinary system diseases in veterinary patients. This requires a thorough understanding of pathophysiology, diagnostic techniques, and treatment protocols, all while adhering to the strict ethical and legal standards governing veterinary practice. The challenge lies in synthesizing clinical signs, diagnostic data, and patient history to formulate an appropriate diagnostic and therapeutic plan that prioritizes patient welfare and owner communication. Within the scope of veterinary technician practice, as defined by the Certified Veterinary Technician Specialist, VTS, Clinical Practice Regulatory Framework, the correct approach represents best professional practice because it demonstrates a systematic, evidence-based approach to patient care. It prioritizes obtaining a comprehensive diagnostic workup, including advanced imaging and laboratory analysis, to accurately identify the underlying cause of the urinary dysfunction. This aligns with the VTS clinical practice standards by emphasizing the technician's role in assisting with and interpreting diagnostic data to support veterinary medical decision-making. Furthermore, it highlights the importance of client education and communication, a cornerstone of ethical veterinary practice, ensuring owners are informed and involved in their pet's care. This approach upholds the principle of beneficence by seeking the most effective treatment for the patient. An incorrect approach that focuses solely on symptomatic treatment without a definitive diagnosis would represent a regulatory and ethical failure. This could lead to delayed or misdiagnoses of serious underlying conditions, potentially causing patient harm and violating the principle of non-maleficence. It also fails to meet the VTS clinical practice expectation of contributing to a comprehensive diagnostic process. Another incorrect approach, such as proceeding with invasive procedures without proper veterinary supervision or informed consent, would be a direct violation of Veterinary Practice Acts and ethical guidelines, potentially leading to legal repercussions and compromising patient safety. A third incorrect approach, neglecting to document findings or communicate effectively with the veterinarian, would be a failure in professional responsibility and could impede proper patient management, violating standards of care and potentially leading to adverse outcomes. Professional decision-making in similar situations requires a structured approach. First, thoroughly assess the patient's presenting signs and history. Second, consult relevant literature and establish protocols for urinary system disorders. Third, collaborate closely with the supervising veterinarian to develop a diagnostic plan, ensuring all diagnostic tests are appropriate and ethically justified. Fourth, prioritize client communication, explaining the diagnostic process, potential findings, and treatment options in clear, understandable terms. Finally, meticulously document all findings, interventions, and communications to ensure continuity of care and adherence to legal and ethical standards.